Today, I injected a patient for TMJ, which is pretty common in my practice. I have a few dental colleagues who refer. They're refractory patients that are grinders. They're going through their appliances with some regularity, or just have refractory pain to all treatments that they've administered. And Botox is really quite amazing for TMJ. In my patients that are predominantly grinders, going into the masseter is really a tremendous pain reliever and can last up to 6 to 9 months. In our patient today, as I was evaluating her for her problems, she pointed that her pain was actually more in the joint and superiorly. And when I see that, that typically is not a primary problem with the masseter, it's a primary problem with the temporalis muscle. And on physical exam, she actually had what would be trigger points in the temporalis muscle, more on the right than on the left. So we did inject the temporalis muscle, which I think is going to be the treatment that's going to address her primary pain. Because she is a grinder, however, we did inject the masseter muscle as well, but I used a lower dose in her because the masseter was actually quite soft, and in grinders, that muscle is really tight, and it's hypertrophied. It's gotten larger because of the active grinding. Interestingly enough, masseter muscles can also be injected for facial contouring. So in women who are looking somewhat rectangular or wider in the lower third of the face, I will use Botox in the masseter to atrophy that muscle to help get that face looking a little bit more triangular. And that takes a little bit longer, a few injections over the course of months to the year. But combination of both symptomatic treatment for TMJ and facial contouring, Botox is a great product.
It was very painless. Excited to see the results, and I'll keep you all updated.